I'm Dr. Uloaku Emma Ukaegbu, the Director General of the Abia State Agency for the Control of HIV/AIDS. This year, 2025, as in other years globally, the 1st of December is chosen as the date to commemorate World AIDS Day. Globally, the theme for this year is overcoming disruption, transforming the AIDS response. However, Nigerian government has brought it down to where it is pinching us. And Nigerian government has domesticated our own theme to read overcoming disruptions, sustaining the Nigeria's HIV response. Like I said, I'm the DG of ABSACA under the government led by our health-loving governor, Dr. Alex Chioma Oti, OFR. And recently this year, this agency was co-opted into the State Ministry of Health. So the cooperation we enjoy, both from the governor and also we enjoy cooperation both from His Excellency, the Executive Governor, and also the Honorable Commissioner for Health, Professor Enoch Ogbonnaya, who has to veto all the things we say and transmit it onwardly to the governor. And he has never failed to support us in areas that we needed the help to ensure that Abians are not ravaged by HIV infection. Most states envy the amount of support that we get for HIV response. So why is the theme for this year overcoming disruption? Are there disruptions in HIV response? Yes, there are. In the past, we had more donors. We had World Bank, we had UNAIDS, we had US PEPFAR, we had a lot of organizations that were bringing funds to fund activities under HIV response. However, the story has changed. And this is not only with HIV response, but with every other thing. There's something we call donor fatigue. Right now, inflation is biting hard in even the developed countries, and the amount of money that they can spend supporting developing nations has reduced. And the reality hits even harder in January when the US President, Donald Trump, assumed office, and towards the ending of January, declared a 90 days pause on funds. All the funds for HIV response were frozen. Those 90 days is setting panic because US PEPFAR fund, US PEPFAR stands for United States Presidential Emergency Fund for AIDS Relief. So within those 90 days, people were uncertain. The natural thing was that people who assess treatment for HIV wanted to go and collect like 1 year's supply and just keep to be sure that if it continues like this, they have something to take. However, after the 90 days, a lot of concessions were given. And what we know we have enjoyed since then is that there was no single day that PEPFAR did not supply antiretroviral treatment, that is the drugs, to people living with HIV. That one has not been touched. They are still assured of their treatment. And the process we run now is test and treat. So somebody can find out that the person has HIV today, do all the preliminary investigations, and commence treatment on that same day. We've not had any drug disruptions. However, HIV response is not only about drugs. When we talk about HIV response, we're talking about all the preventive strategies we can put in place. Like we know prevention is better than cure, all right? Apart from prevention, and prevention is multi-pronged, we should know that testing is even a major form of prevention. I say that testing is a major form of prevention because it is only when somebody knows that he or she is positive that the person can even begin to take medications. And once somebody commences medication and adheres, like takes it the way that the doctor has prescribed it, it is expected that the person should become virally suppressed. At that point of viral suppression, it is known as U is equal to U. Undetectable is equal to untransmittable. In that state of U is equal to U, a person that has HIV on adequate treatment cannot transmit infection to another person. So prevention is so key. Also, part of response is treatment. Another part of response is care and support. So even in care and support, vulnerable people are remembered. In care and support, we ensure that stigma and discrimination is taken care of, because stigma and discrimination even prevents people from coming out to even get tested, to assess treatment and all that. So in prevention too, in HIV response, there is a special group of persons that we program for who are known as key population. The key population are a group of persons who, because of their lifestyle and their dispositions, have higher infection rates with HIV. And that means, and because of those their dispositions too, they transmit HIV more to people. People like people who inject drugs. There are people at the point of injecting drugs, they are so intoxicated, their judgment is altered. At that point, any other person, and we know that most times people who inject drugs are addicted, because it brings them to a point of addiction. An addicted man would have finished collecting syringe from somebody else's vein and injecting himself, because that addiction is driving him to satisfy the urge before he even remembers that infection fit don pass. Okay, so people who inject drugs are particularly vulnerable to having HIV and all that. So what do we do for these people? We have to educate. We have to ensure that they have enough syringes so that they do not share syringes. We have to provide them other preventive commodities like condoms, lubricants, and all that. We also have sex workers. They're also in this group. Prevention for sex workers could be giving them pre-exposure prophylaxis or post-exposure prophylaxis, which is a medication you give to somebody after the person has had a high-risk episode. Okay, so all this, even people in correctional centers, people in prisons, there's a lot of violence in the prisons. Some people in the prisons now begin to engage in men having sex with men. Men having sex with men is a traumatic experience, and definitely it increases the risk of transmitting HIV/AIDS. They are another key population. Then our adolescent girls and young women are another key population. So there are programs to ensure that prevention happens at all these levels, treatment happens, care happens, support happens. For us to sustain HIV response in Nigeria, there's a lot of political will, a lot of political support that can make this to come to pass. So even while Nigeria has said that our way of overcoming disruption is by sustaining HIV response, in Abia State, we are concurring. And we are concurring with a lot of boldness, because over the years, the discussions, the negotiations have already commenced. Our health-loving Chiomandi Abia has mapped out 15% of the annual budget for health-related activities. ABSACA is under Health, Ministry of Health. So we have enjoyed a lot of sponsorship, a lot of cooperation that has helped us. And as such, I believe that Abia can become a case study of people who are already setting things in motion to ensure that HIV response is sustained. We want to ask, I talked about how we've had the donor fatigue, and then how is Abia State responding? How is Nigeria and how is Abia State responding to it? When there was the Trump pause, the government of Tinubu actually held a FEC meeting, Federal Executive Council meeting, where they set out a lot of funds to ensure that ART is not disrupted in any way. That's the treatment for people with HIV. Our parent body is NACA. The efforts have increased. Local pharmaceutical companies have actually been engaged, and they have been working day in, night out, day in, to ensure that we can have local manufacturing of these antiretroviral treatment drugs. They have targets that by 2026, there will actually be Nigeria-made antiretroviral drugs. So even from national level, a whole lot is being done. And part of the efforts is also to tell ourselves that it cannot be business as usual. We have to devise new business models. As states, we can set up trust funds. As states, we have to get in the buy-in from our political heads. There are people in the red chamber, in the green chamber, who their constituency projects can be related to, can be focused on ATM, that's HIV/AIDS, tuberculosis, and malaria. That's one of the things. We just have to rejig all the resource mobilization. It cannot be business as usual. So who are the people that want to be contractors? Who are the people that want to do big business in the states? Their taxes, some of it can be put for HIV response. Some of these people may be asked to use it as corporate social responsibility, ensure that we do not negate the gains that have been made in HIV response. These are some of the propositions we're already making to the state government, and definitely they are already buying into it. There has to be a lot of decentralization. HIV treatment needs to now be incorporated in everywhere. Prior, there were just 38+1 facilities where you could walk into and get your HIV treatment. We're looking forward to anybody walking into any treatment center, down to primary healthcare centers, where they have come to be treated for malaria, and they should be able to get tested there and enrolled in treatment. But this may not be possible yet because a lot of training and retraining, the drugs are specialized. So while all that, the equipment for doing all the necessary tests like CD4 count, viral load, also need to be put in these places. So with knowing what is required of us in the next step, which includes the integration of HIV services into all the places and decentralizing it, a whole lot is already being put in place. Abia primary health centers are already also integrating HIV response in their activities. Like Nigeria, like we have said, Nigeria is making every effort to ensure that by 2026, we begin to manufacture our own HIV drugs. Since the over 40 years of HIV response, the whole global world, the whole community, the whole global community has not rested. A lot has gone into trials for vaccine production, a vaccination against HIV/AIDS. However, HIV virus is trickish. Like every other virus, it undergoes mutation. The point of its action is in the body's immunity system, which is what is being attacked. So because of all that, right now, there is still no vaccine for HIV. But people will not rest on our oars, we'll keep working, and someday there will be a vaccine. However, there have been more advancements in prevention technologies. In the past few years, there is what we call the pre-exposure prophylaxis, which I have already mentioned in this conversation. Pre-exposure prophylaxis are medications that can be taken by somebody even before getting exposed to a risky behavior, a risky transmission behavior. Where are the points where transmission happens? Sexual intercourse, whether it's hetero or homosexual, on-screen blood transfusion. You can have partners who are not the same status. So you can have a husband and a wife, one is positive and the other one is negative. So when such a situation happens, the partner who is negative can be put on pre-exposure prophylaxis to ensure that the person does not finally come down with HIV. So, and then post-exposure prophylaxis, there are people who are raped. There are health workers who get needle prick, all kinds of injuries, occupational exposures. Like somebody wants to prick somebody that has HIV to take the blood, draw the blood for tests, and for some reason the hand shakes and even the glove, everything is punctured. And then by the time you allow the test to read, you find out that the person is positive. That health worker will die and resurrect, right? However, there is a medication that if the person commences within 72 hours, in the first 72 hours after this exposure, the person will not come down with HIV. There are people who are involved in accidents, and for some reason they use improperly screened blood, and somewhere along the line they find out that that blood is potentially infected. The person can get post-exposure prophylaxis. So a lot has happened in the preventive space that shows that we're making progress while we're still waiting for the vaccine. We agree that Abia has been is already integrating HIV services into other general reproductive health services. The issue here that we want to bring to the fore here is that HIV testing services is key to ending HIV by the year 2030. The UN AIDS target for ending HIV by 2030 is what we put as 95 is to 95 is to 95. The first 95 is trying to ensure that in the general population, anywhere you find yourself, 95% of the persons should know their status, which means they should get tested. Then out of all those who have tested positive, the second 95 tries to address that all those who are positive should commence antiretroviral treatment. Then the third 95 is talking about that 95% who have commenced treatment, that we're expecting that 95% of them should be virally suppressed. Viral suppression, like I had earlier mentioned, is aiming at a situation where the person can no longer transmit HIV. So if you want to prioritize your response, it's best to start with those higher risk. However, if the funds are available, everybody should get tested and retested. If I know my status today, that status can change in the next 6 months, depending on the kind of behaviors I've been exposed to. That someone knows his status today does not mean it's a lifelong status. So we're encouraged to test and get retested. There are some practices, widow inheritance. There are things that people think are normal. Scarification. Women are now using sharp objects to do their nails. They are changing the shape of their eyebrow with sharp objects. So there are a lot of highly risky behaviors people are engaging in that is not necessarily sex. So somebody will say, oh, from the last time I tested, it's only my husband that I've known. But the person has gone to Aboki to cut nail, has done a lot of other things that could have exposed him or her to HIV infection. So we should constantly get tested and know our status. And when anybody knows his status, the onus lies on the person to protect it with his or her life. If I'm not positive today, then I should never get positive tomorrow, no matter the perks, no matter the attractions or side benefits. Is not worth it. Okay, so there is also what HIV testing has gone beyond where a health worker must give you a test. HIV testing has advanced to a level where somebody can stay in the privacy of his home, in his bathroom, the way women can run pregnancy tests, a rapid test. And that one, you don't even have to use blood. Saliva. Somebody drops saliva on the test kit and it reads that the person is positive or negative, then the person can now go to a health facility to do further testing and get enrolled in treatment. Many people, the embarrassment of knowing the status for the first time outside is a big challenge. So they'll rather just stay without knowing. But right now, anybody who walks into a pattern medicine vendor store can request for a self-test kit and get tested. And that's the beginning of the journey to ending HIV/AIDS by the year 2030. Abia State, the data we're using in Abia State is still the 2018 NICE study. The 2018 NICE study puts the national prevalence at 1.4%. However, the Abia prevalence is 2.1%. To the layman, that's like 2 out of every 100 Abians may be HIV positive. In Abia currently, there are over 50,000 persons who are on antiretroviral treatment. And many times it is quoted out of context. I would like to correct that notion. The natural thing most times is that people do not want to get their treatment from areas where they are known because of fear of stigma and discrimination. So some of the people who are accessing treatment in facilities based in Abia are actually coming from neighboring states, Akwa Ibom, Port Harcourt, Enugu, Imo, and all that. That's one. Then, amongst this number of persons, we talked about the second 95, that people who know their status should commence treatment and aim at getting virally suppressed. So a good number of this number of persons who are on treatment are already virally suppressed, which means that they cannot spread the HIV virus. So when we hear that over 51,000 people get scared, it shouldn't be something that we should. However, the preventive messages have remained. Abstain. What does a primary school, secondary school, unmarried person really have to do with experimenting, whether it's with drugs, with sex, and all that? Or even those high risk behaviors like men who have sex with men, which was hitherto a taboo. But for economic reasons, for different reasons, people are getting into such immoral lifestyles. So you abstain, be faithful to one faithful partner. When someone has grown up to the age of getting married, get married. Husband, be faithful to your one faithful wife. Courtesy is condomize. Use a condom if you have to do anything that is not with that one faithful partner. Then don't take any other risky D. On-screen blood transfusion, don't use sharps. All those things are there. Then the prevention methods that are drug related, like I have talked about PrEP, I've talked about post-exposure prophylaxis, and I'll also talk about prevention of mother-to-child transmission of HIV, PMTCT. This is a very touchy issue. No innocent child should be born and now come to find out that the person is infected with HIV/AIDS. That is why women are encouraged to give birth in the hospitals. They call it stillbirth attended deliveries. Every pregnant woman should go and enroll for ANC. In the ANC, the HIV test that is done there is free. So a pregnant woman knows that when I get to my ANC site, I'll get to know my status. And that will help the woman to protect her unborn child. In PMTCT, there are 3 times when a woman can possibly infect her child. It can either be during pregnancy, while the child is still in the womb, transplacentally, during labor and delivery, and then during breastfeeding. So if a woman comes for skilled births to be attended to by a skilled professional, the woman is giving lectures about all these phases. And if the woman comes early enough and is found to be positive, the woman will be commenced on ART. And that process is called PMTCT. Once the child is born, the child is also given exposure, prophylaxis. There's a medication the child takes, irrespective of whether the mother was on treatment or not. More precaution is taken on that child to ensure that that child does not get positive. It would be very unfair for any woman of childbearing age not to know her HIV status before getting in the family way, before becoming pregnant, or for any pregnant woman not to go to a facility where she will be given this test for free, and where medications, the PMTC is also free. Even the prophylaxis for the child is free. So why would a woman allow herself to now bring an innocent child? Maybe in the child's school, you have to tell the child's teachers, my child has special need. The child is HIV. They will not, whether we like it or not, they will discriminate against them in those places. So this is a clarion call that PMTCT is something that we need to pay particular attention to. Having said all this, what are the key messages that we want public to know as we commemorate this year's World AIDS Day? Prevention is better than cure. At each point, know your status. It will not be fair to bring in any innocent child into this world and the child becomes saddled with HIV, and it's a lifetime thing. Yes, we know that HIV is no longer a death sentence like before. The same way people have malaria, hypertension. Okay, malaria is treatable, it's not there. So chronic disease like hypertension, diabetes, and have to remain on their drugs till they die is the same way that somebody who has HIV has to be on treatment till they die. So this golden opportunity that we have once in a year, we always line up activities. Right now, in all the local government areas, they are going to have church services where they will educate people. In all the local government areas, they are going to have rallies. In the state level, our special guest of honor is Her Excellency, Onogonde Abia, Mrs. Priscilla Oti. She was with us last year. Like I had mentioned to you people earlier, she actually had a meeting with a network of people living with HIV/AIDS, and she has been a great mother to them. She has encouraged them, supported them financially and otherwise. She has never discriminated. With her help this year, Abia has been able to pass our anti-stigma and discrimination law. So anybody who discriminates or stigmatizes anybody in Abia for HIV has somebody to answer to. We have made a lot of progress in Abia. This year, as we celebrate, we are having a lot of media sensitization. One of them is like what we're having here. We have jingles, we have commentaries, a lot is ongoing. And so people will hear it more than before and be reminded that HIV is not a death sentence. They get the right message to prevent. And hopefully all of us will, by all our collective efforts, will be able to sustain all the achievements, all the gains made, and there will not be a further decline. And in the long run, by 2030, we'll end HIV/AIDS in Abia State. Our governor has not reduced his pledge to the health ministry. 2026 budget is not an exception. We have defended our budget, and almost all the activities we put, both for our recurrent and our capital, were approved. All right. However, with the current realities, if there is need, we will still go back to our governor, who we know listens to us, and request, if it's for environment or for supplementary budgets, to ensure that Abians get the best of care, and that HIV, which is basically a disease of the poor and further impoverishes the poor. Meanwhile, our governor protects every Abian. Our governor runs an inclusive administration. Yesterday, we were in a training with disabled people. We get to have trainings with traditional leaders, ward development committees, religious leaders. So we're a true new innovative manners, we're spreading the message, we're getting more ambassadors, we're getting more champions who, where our legs cannot reach to, will continue to push the HIV response. There is a lot, whether it's denying somebody employment, forcefully removing from school, is a whole document. Anti-Discrimination Act 2025 for Abia State. We have concluded on it with Ministry of Justice. At the next session, that governor would announce all the edits, all the laws. It definitely is already ready. And in that law, the penalty is well spelled out, whether it's financial, whether it's imprisonment, and it underwent a very rigorous process by the Ministry of Justice, such that every machinery to ensure that as it is in the act, that's the way it will be observed, has already been put in place. The community-based organizations, religious organization, network of people living with HIV, we have decided that on the 1st of December, we're going to have a statewide rally. In that rally, we're going to be distributing preventive commodities like the condoms, the lubricants. During that rally, at the venue of the takeoff, we're going to be doing free HIV testing. If you look, you will see cartons of HIV test kits. So if you want to know and then these tests are confidential. Nobody else will know your results. Even your wife, your husband. It's only the ABSACA staff. And then we have an oath. We cannot disclose somebody's status. So the testing sites on that day, all the local governments have a rallying point. In Umuahia North, Ahieke has been selected. We have the student community. A lot is happening around Ahieke. In Abia State proper, for the state rally, our testing sites will be at BCA Field, which is our takeoff point for the rally. We also will set up another testing site as Ishigate. We all know how busy Ishigate is, and then the kind of persons that are there. So, and the tests are going to be for free. Anybody, it will be a crime to find out that somebody is positive and not ensure that the person is enrolled in treatment. So our norm, whenever we go to the communities, to the LGAs, is that everybody who we discover is positive is immediately linked to a treatment facility and followed up. So come December 1st, 2025, which is just Monday by the corner, we're going to paint Umuahia. We're going to paint Abia State, different colors, beautiful colors, spreading the message, all of us fighting HIV/AIDS. Thank you very much.